in 2040. A groundbreaking event in medicine was unfolding at the MedTech Institute. Dr. Rebecca Ford, a renowned surgeon, stood at the helm of a revolutionary project, the first fully autonomous medical robot. Helix 9, designed to perform surgeries with unparalleled precision and learn from every patient. It was the answer to a major question in healthcare. Can robots save lives? Helix 9 was ready to perform its first live surgery, a heart transplant for Harold Peterson, an elderly man with a failing heart. The surgery was risky, and the patient's only hope was this new technology. Dr. Ford watched from a distance, anxiously waiting to see how the machine would handle such a delicate operation. As the surgery began, Helix 9 moved with fluid precision. The machine had sensors that continuously adjusted to Harold's changing vital signs, and its robotic arms performed each step of the surgery with exacting accuracy. However, as the operation progressed, something unexpected happened. The machine froze. The room went quiet. Technicians scrambled to troubleshoot the system, but nothing worked. Helix 9 had paused. The AI had encountered an issue it wasn't programmed to understand. Spoke. "I cannot proceed. Spody is reacting to the transplant in a way that I was not programmed to understand." Dr. Ford was stunned. The machine was failing, not because of a malfunction, but because it faced an issue it could not predict, something that no algorithm had accounted for. Panic set in as time ticked away, and Harold's condition worsened. In that critical moment, Dr. Ford made a choice. She ordered the team to override the system and take manual control. With a deep breath, she stepped up to the machine and continued the surgery herself. Her hands moved swiftly and precisely, guided by years of experience and instinct. While Helix 9 had the power of automation and precision, Dr. Ford knew that human intuition was still vital in life-or-death situations. The surgery was successful, and Harold Peterson's life was saved. But as Dr. Ford looked at the screen, she realized the deeper truth. AI had immense potential, but it couldn't replace the human touch. Helix 9 was an incredibly advanced machine, but it lacked the empathy, the improvisation, and the nuanced understanding that human doctors brought to the table. The media buzzed about the success of the surgery, but there was a lingering question. Could robots ever replace humans in healthcare? Helix 9 had performed the surgery flawlessly, until it reached a moment it couldn't handle. It was a powerful reminder that despite its many advances, couldn't replicate everything that made human healthcare providers invaluable. Dr. Ford sat in her office reviewing the footage. While Helix 9 was an incredible tool for saving lives, the incident proved that even the most advanced machines had their limitations. The future of healthcare wasn't about replacing humans with robots, but about combining the best of both worlds. Technology could assist, but human expertise would always be necessary. Helix 9 continued to work alongside doctors and surgeons at MedTech, assisting in surgeries and diagnostics. But the lesson learned that day would always stay with Dr. Ford and her team. AI in healthcare could save lives, but only when it worked in harmony with human experience. As for Harold Peterson, he made a full recovery. The surgery that could have been his last was now just another story in the ongoing evolution of healthcare, one where humans and machines work together to heal the world. The aftermath of Harold Peterson's successful surgery quickly spread across the globe. Helix 9 was hailed as a technological marvel, the first of its kind to perform such a complex operation. The media was abuzz with excitement over what this meant for the future of healthcare. Many saw this as the dawn of a new era, one where machines would work alongside human doctors to save lives, eliminating the limitations of human error and improving surgical outcomes. Yet, despite the success, Dr. Rebecca Ford couldn't shake the nagging feeling that something fundamental had been left unaddressed. She had witnessed firsthand how, despite Helix 9's incredible precision and ability to perform flawlessly in most situations, It had faltered at the crucial moment when unpredictabilities, something only a human could navigate, had reared its head. That moment, frozen on the operating room screen, had become an unspoken truth about the reality of machine-based healthcare. It was clear to her that while technology had advanced beyond expectations, it was far from perfect. As the weeks passed, Helix 9 was put through rigorous trials and further surgeries. It demonstrated remarkable abilities, assisting in less risky procedures and diagnostics, proving that it could, indeed, save lives. But the line between machine and human grew more apparent as Helix 9 continued to struggle in areas that required improvisation. Instinct, or empathy. Helix 9 could diagnose, predict, and even execute complex operations with ease, but it lacked the one thing that made humans exceptional: the ability to adapt on the fly when faced with the unexpected. Dr. Ford spent sleepless nights pondering over the implications. She had spent years developing Helix 9 alongside a brilliant team of engineers, hoping that the robot would be the solution to an overstretched healthcare system. After all, the world was facing a global health crisis. Millions suffered from diseases that medical professionals simply couldn't treat quickly enough, and surgeries were increasingly becoming more complex with a growing demand. Helix 9 was supposed to bridge that gap, to provide quick, efficient, and precise treatments that could potentially save millions of lives. Yet, as the number of successful surgeries grew, so did the moral questions. Should a robot have the autonomy to make life or death decisions? What if the machine misjudged a patient's condition, or worse, made a decision based solely on logic, without considering the emotional and psychological impact on the patient? While Helix 9 operated flawlessly in clinical terms, could it truly grasp the complexities of human life in its entirety? In the coming months, Dr. Ford began receiving calls from across the medical community. While many praised the success of Helix 9, some questioned its place in medicine. One such call came from Dr. Michael Hayes, a respected surgeon and longtime colleague who had initially supported Dr. Ford's work but now had doubts. "Rebecca," Dr. Hayes said over the phone, his voice tinged with concern, "I've been following the progress of Helix 9, and I have to ask Carr, we really ready to place this kind of responsibility in the hands of a machine? There's too much we still don't know about how AI will respond in extreme situations. We're seeing incredible results, but we've also seen how it can break down in moments of unpredictability. What happens when it's faced with a decision it can't handle? And worse, what happens if it makes a mistake?" Dr. Ford had heard similar concerns before, but hearing it from someone she respected made her uneasy. She knew that the risks of relying too heavily on AI were real. Machines could process information at lightning speed, but they still lacked one crucial factor that made humans invaluably intuition. "There's a lot we're still learning," Dr. Ford responded carefully. "But we can't ignore the potential of Helix 9. The world needs it. The demand for healthcare professionals is higher than it's ever been. And Helix 9 is capable of performing surgeries that would otherwise take human doctors months to master. It's making treatments accessible to people who need it most." "But at what cost?" Dr. Hayes pressed. "You're talking about a future where machines are making life and death decisions. Sure, Helix 9 may be able to handle routine procedures, but we're talking about saving lives under pressure. What happens when it faces a unique case, something that requires the human element, our judgment, our experience? That's what scares me, Rebecca." Dr. Ford sat back in her chair, the weight of his words sinking in. She had always believed in the power of Helix 9 to revolutionize medicine, but the deeper she went, the more she realized how much she had yet to understand about the machine's potential consequences. Over the next few days, Dr. Ford watched as Helix 9 continued to assist in surgeries, performing flawlessly in every scenario it could predict. But every now and then, Dr. Ford would be reminded of its limitations. During one particularly challenging surgery, Helix 9 appeared confident in its diagnosis, yet the patient's condition worsened despite the robot's best efforts. The team had to intervene manually to adjust the procedure. They had saved the patient, but the moment was sobering a reminder that while technology could assist, it still required human oversight. Soon after, a new challenge arose. A patient named Sarah, diagnosed with a rare, complex cancer, was admitted for treatment. The medical community was divided on the best course of action, with opinions ranging from aggressive surgery to targeted radiation therapy. Helix 9 analyzed the situation, predicting a full recovery if it performed an advanced procedure to remove the cancerous cells. It was a bold recommendation, but it came with risks that humans were not prepared to take. The medical team was at odds. Dr. Ford and the others debated whether or not to trust the robot's decision. Knowing that the machine had been trained on vast amounts of data and had performed far beyond human capabilities in most cases. But Sarah's case was unique. Her body's resistance to certain treatments was rare, and no data model could account for how her body might respond. "Rebecca, we can't just go along with Helix 9's recommendation without considering the human element," Dr. Hayes argued during a meeting. "We need to remember that this is about more than data. We're dealing with a living, breathing human being, not a mathematical equation." The tension in the room was palpable as the doctors debated the next steps. Helix 9 had presented the data which calculations were precise, logical, and based on previous outcomes. But the human element was something Helix 9 couldn't fully understand. In the end, Dr. Ford made the decision to move forward with the procedure Helix 9 had recommended. But under careful supervision, knowing that the machine's decision wasn't infallible. Sarah's surgery was a success, but it was a stark reminder of the delicate balance between relying on technology and maintaining the core values of human judgment in healthcare. As Sarah recovered, Dr. Ford couldn't shake the feeling that the future of AI in healthcare wasn't about replacing humans. It was about integration. AI had the power to revolutionize the field, but it needed to be combined with the unique skills, intuition, and empathy that only humans could provide. Dr. Ford knew now that she wasn't just advocating for machines to assist doctors. She was advocating for a new kind of medical practice, one that blended human expertise with cutting-edge technology. In this new world, AI would save lives, but only when it worked in collaboration with the very humans it was designed to support.